proven to be effective. Medical associations, including the American Medical Association, the Association of American Physicians, the Association of American Medical Colleges, the Association of Physicians and Surgeons, and the American Nurses Association all support public masking as an effective, efficient, and affordable way to prevent the spread of COVID-19. I interact daily with our health caregivers in our community, and I am compelled to promote and protect the health and welfare of these caregivers. One simple way to reduce the number of ill people in our community requiring treatment in our emergency departments and inpatient areas is public masking. Evidence has shown that communities with mandatory mask orders have significantly less spread of COVID-19 than those that do not have the orders in place. Due to the continued increase in community spread, the COVID-19 capabilities and capacity of our healthcare system are being taxed. I will tell you right now, as Parkland, we have the highest number of COVID inpatients we have had since the beginning. We have 23 positive patients and 10 currently being tested. We have 8 personnel in the solution system. We have 23% positivity rate that I mentioned in the last 7 days. Back in March, we only had 6.8%. We have last week in our ED volume, 41.2% of those people were either COVID positive or suspected. All the precautions that my staff have to take to prevent their own health.
Thank you very much. And the next name we have is Wayne Hutchins.
Yes.
Come on up.
Speaker in general. So I apologize for the stumbling and fumbling. Secondly, I would like to say that I do support mask mandate. I've seen some of what goes on social media. As a matter of fact, I've seen a lot of the lack of civility for Ms. Elliott and her staff. I think it's been ridiculous. We've lost our civility, and with our civility, we've also lost good common sense. And you can trust individuals to make this decision instead of having it kind of, I hate to use the word dictated, but we wouldn't pass our local restaurants and our local taverns and see them at capacity and no one wearing masks. In my industry myself, we actually mandate by our protocols that our individuals wear masks. We pay them to follow the rules, and yet we have to fight them to follow the rules. So trusting each individual to make their own personal decision is not going to work. It simply does not. If we're going to save lives, we're going to have servants. Ms. Elliott, thank you for all that you have put up with, the threats, the rude things that are said. Thank you for being here. Thank you, folks.
Doug Bloom?
I'd like to, I'm not a public speaker, but I don't know if anybody in here has ever been through any kind of biological or chemical warfare training, or even knows what the particle size of a
Get my
virus is.
number from
You'd be dead in a heartbeat. So would you, all you do is a paper mask. If there's any thing in the side, you're gone. Those masks will not prevent you from getting the virus. Common sense and hygiene will keep you from getting the virus. So a virus particle will go through those paper masks. The only thing you're going to be able to do is wear a respirator, like firemen wear, EMS, police, military, to keep those virus particles out of your system. Do a little research on it. The virus particle is nothing more than a biological chemical. That's all I have to say.
Thank you very much for your time.
Oh, this guy here is the only one that's got a mask that may slow it down.
Cindy Lacy?
Thank you for your time today. Two questions are before us today. Are masks effective, and do county health boards have the right to mandate masks? In regards to question number one, guidelines from the Center for Disease Control and Prevention state that those who come in close contact with someone for more than 15 minutes could spread the virus regardless
Okay. Can someone test it on the other end? No, I meant on the YouTube.
Oh, on the
listen,
YouTube.
Yeah.
To see if it's, if I plug it in here.
Ashley says it's working, the sound.
No, I meant on the YouTube. There we go. Okay, I can hear you guys now. Okay.
You can't hear it now on there.
Okay.
Yeah.
All right, let's proceed.
He's ready.
Ready?
It's going. Yep.
Alright, rotation. First,
Well, guys, I'm looking around this room, I'm absolutely terrified. What I see. I'm not particularly a brave man, but I once walked between two guys who were trying to kill each other with razor sharp trowels, and I wasn't nearly as scared of them as I am today. You say this isn't political, you say it isn't emotional, it is. 30 years ago, we had psych drugs being pumped into our children. Then about 10 to 15 years ago, we got fluoride in all our water. And now to this. It's eroding our freedoms one at a time, making people less and less free, less and less ability to think on their own. And I don't deny that COVID's real. I even know a couple of people who had it with COVID. I do not believe that it is the pandemic that everybody claims that it is. I do believe it's real. I think this is a scare tactic to see that just how far the American population can be pushed before they react. That's all I have to say. I do not believe that it is.
thank you. The final speaker is Renee Murphy.
Thank you. Hi, everybody. Since China released this virus onto our shores, we've been told many things by the government. First, the Surgeon General and NIH and CDC said that masking was dangerous for us because we wouldn't use the mask right. We would be touching our faces anyway. People would have itchy noses and they'd scratch their nose under the mask. And it would be dangerous for us to do that. Also, they pointed out that the virus is way smaller than a cloth mask could stop. And the only way that you could keep the virus from entering your eyes, nose, or mouth would be through some kind of a respirator, which none of us have. Then the government changed their mind because, I don't know why they changed their mind, they decided that maybe asymptomatic people could spread the virus. And if that was the case, their droplets might get onto us, and if we were closer than 6 feet. So the same people that told us that it was dangerous then told us to put them on. I don't know if they work or not. I usually say, you want me to put on a mask, I'll put on a mask. I do not want the government telling me to put on a mask. It is a stupid and dangerous idea to have a mandate. When you have a mandate, you have tyranny. Who's going to enforce it? We don't even have enough police to enforce our laws that we have right now. Are we going to have the mask police? Are we going to have a tip line? When you have a mandate, the child abuse tip line gets abused. I can't even imagine what a nasty tip line looks like. And I would like to know if the people at Parkland are trying hydroxychloroquine and zinc. Why is it always a mask? How come we don't have a treatment? How come we don't have a cure? How come we're supposed to wait for a vaccine that's untested, but we can't use a tried and true method like hydroxychloroquine and zinc? And if we bring it up, we get pulled off of Facebook. Not good, not good. A gentleman earlier said, we can't trust the individual to make the right choice. Oh yes, we can. We can't trust petty tyrants to make the right choice. We need to make the right choice for ourselves. This is America. This is not China. And I would point out, they're still having outbreaks. their masks on. Oh, yes. Sorry to get nervous, I'm not a good public speaker, believe it or not, but this is very important. And if you start telling people what's put on our face for their own safety, the next thing you know, it's a slippery slope from that to the hijab. What if, in 50 years, women get beaten up if they're not wearing a hijab? We're gonna all have to put one on for our own safety? Think about it.
Thank you very much.
Well, I put literature over there about this.
The speaker did bring some literature. It's over there. The health center does not, not a part of that. We don't take any claim to it, so it's just up to you.
That's from the World Health Association, so we take that from us.
Over there. All right, now, if you picked up an agenda, you probably noticed, we are not voting on a mandate tonight. We're having a discussion of pandemic response and public health policy. So there will be no vote tonight on yea or, yes or no. All right, the board, you have in front of you, I believe, you should have.
I think should we ask if anybody else has anything?
Okay.
We can't speak, we can't speak.
We have to sign in. Unless, no, I don't think we can do that.
30 minutes.
I don't think we can do that.
Jackie, it's not been 30 minutes yet.
What you think?
I signed in at 4 o'clock where they told me to sign in.
Total. It's not been 30
Oh, we still
minutes.
have some minutes, all right. How many others are there?
Again, I'd like
Dr.
to,
Gamble, would you keep track for me of the time, the 30 minutes?
It's 4:22.
4:05.
We need to take out the time that you had to stop the technical errors as well.
Identify yourself.
Overcast, I'm a doctor here. I really appreciate the job that you've done. I don't know anyone that would want to step in your shoes after what you've done. I appreciate our veterans who give us the right to come here to speak. I've taken care of many of your families. I go to church with you. I play sports with you. Our children are in school together. The simple fact is, my office is one of the largest healthcare providers in this entire county. Since the World Health Organization has declared this a pandemic, as of today, I have seen nearly 11,000 patient visits where I lay hands on patients and get them well in our community. There is at no point any literature that talks about the safety or the effectiveness of mandating masks on children. By looking at children, if there's anything worse than not having PPE when you need it, it's using PPE incorrectly. When you see people going into stores, and you see these people who've been mandated to wear these masks for months now, pulling these things down, touching their face constantly, wearing the mask over and over and over again. At my school alone right now, they're making 2-year-olds wear masks. The teacher is having to apply the mask. She literally touches every mask, places them in a safe space, picks up every single mask, puts them all back on, shares her germs with those children. And at no point does that do anything for our health. Secondly, I would like to reiterate what Ms. Renee said as well, is that in a community like this, your job, as I see it, isn't to tell us as physicians or as educated people what to do. It is to give us the statistics that you have and to allow us with educated choice from you to be able to make our own decisions about our health. There are many things that we can do for our health. When you look at COVID-19, the reasons that most people die have to do with age, obesity, and comorbidities. Right now, if you're looking to mandate things, I would suggest maybe we look at mandating people diet, lose weight, exercise, if you want to lower the death rate truly in this country. And again, as a healthcare provider, seeing that many patients, my job is to put patients on medications. I appreciate people who are here in our community that have knowledge and education to do that. My job is to give surgeries when necessary to save lives. I appreciate those people as well. My job is to get people healthy and to get people well and to remove medications from their life and teach them about their health. When we talk about speed limits, when we talk about stop signs, when we talk about seat belts, do not kid yourself that that analogy has anything to do with the God-given immune system that you're here with. None of us would be alive today without that. Period. So looking to mandate something, you're going to hurt people in this county that are running small businesses. How many of you have heard, I will not shop somewhere where they mandate me wear a mask? You're going to punish those people. Walmart figured it out in less than a week. In less than a week, that they were putting their employees at danger, and if people stopped coming in and spending money in their business, we've already shut down our community. Everyone did their part. Their schools were closed, their churches were closed, their sports were canceled, their vacations were closed.
Your time is up.
Thank you, sir.
And I need you to sign for our record.
Anyway, I'm against the mask mandate.
We're just, Dr. Daniel, we're sure they are out of time.
Yes, 5 minutes.
5 minutes was good.
Hello everyone, my name is Billy White, I live in Frankfurt. I wore a mask today because I believe that before I came in, that they would require me to do so, or that they would like for me to do so. I'm gonna take it off while I'm standing and I'll put it back on before I go out. There's a couple things I live by. Other things just make sense to me. So I'm gonna make 2 quotes, and I'm not here to preach at anybody, but only to just say that Benjamin Franklin observed that people who ask us to give up freedom in the name of safety would deserve neither, first of all. And he went up, and it just seems to me it always ends up with lose both. Okay? Now, I'm not convinced of the effectiveness of masks. I'm not convinced that, like this doctor said, about the factors that have brought about loss of life during the COVID time. I guess someone brought up that one of the questions we're here to decide, or we're here to talk about at least, is to say whether or not the board or an executive entity or even the Congress has the right to mandate masks. Well, there's no question they do. And the governor or the county council can mandate masks on your recommendation, and it would be tested, and it would come out that it's an emergency, it had to be done. So therefore it would be justified under the law. So the other thing that I wanted to quote to you is from Thomas Jefferson. You may have read it, it's in the Declaration of Independence. It says that governments derive their just powers from the consent of the governed. So there's no question the government has the right to do that. The question is whether it would be a just power or not a just power. When the government exercises just powers, we have a legitimate duty to obey those rules. When the government exercises an unjust power, we all have to make a choice for ourselves if we're going to obey that. But I just submit to you that that's the definition of tyranny, is a government exercising unjust powers, defined as, we can talk about that, defined as what? Something in the name of science that's not at all conclusive. That just doesn't seem to be a just power to me. Everyone would have to answer that for themselves. Anyway, I thank you for listening to me. I guess the only thing I'd say is that everybody's going to make a choice. That's my signal.
That's it.
Okay.
Thank you very much.
Thank you guys very much.
Your name for our record.
Sure.
Anybody else to speak?
We have a couple of community members back here that would like the chance to speak if you guys have time.
We got 1 minute.
I'll check those. I should have checked.
Somebody like to say something real quick?
They can only have a minute.
We have 1 minute.
1 minute.
Okay, he said he'd keep
One
it
minute,
short.
1 minute.
Did you put the time back in that we had technical difficulties?
check on my notes real quick.
HERBST.
Hello, my name is Chris. I just want to make this real brief. First thing, I want to thank Amber for being transparent throughout the whole process. I've been a big fan of streams, and I think that thus far the health department has done a great job handling this crisis. Problem is, y'all with these mandates are crossing a red line. The government does not need to be determining this type of things. It can't be enforced. It's going to hurt our small businesses. Right now, they're operating with relative freedom, not having to worry about too much of the social distancing, the masks. People are still making money down here. We start acting like St. Louis County, we're going to put a lot of people in the world of hurt. That's basically it. I think that most people who came here before me pretty much said what I was thinking. I just want to get my words in. I appreciate you guys letting me in without officially being on the agenda.
Okay.
Thank you.
Sir, we need you to sign for our record that you spoke.
Thank you.
Board, did you all bring with you or you have a copy of a draft?
Yes,
Anybody has that?
yes.
Okay. As I said, we're not voting yes or no. We're having a discussion, and as a means of discussion, we have before us, it's called Emergency Face Covering Order, St. Francis County Health Center, but it is just a draft. It does not mean we're adopting it. We're going to go through it and use it as a discussion. Yeah. So, all right. Why don't we look at the first page?
Let's pass it about so we can read it. We can't, half of us can't understand what you're saying.
Okay. We don't have copies. You can make copies?
Yeah, that'd be a good idea.
But now, there will be no discussion for the audience.
Right. Al Sullivan done that one time.
Those of us who are half deaf are extremely restricted on what we can hear these
That's
days.
me. Well, tell you what, I'm gonna call a break of 5 minutes while they run off these topics. So, if you need bathrooms or in the hall, stretch your legs, socially distant, please. What? You need a copy, okay. I may have brought mine. Oh, I don't have it all.
Sit down if you do that. Sit down if you do that. You guys eating something yet? I haven't been in the shoot for 5 years.
The election officials. We need another copy. I didn't say earlier, but if you silence your phone, I'll laugh and tell you why I always try to remember to say that. I was at a reception in the governor's mansion. He wasn't there. A bunch of retired teachers, and had all the butlers and all the white glove people serving all this food. And my daughter called me. Doesn't sound bad, except the ringtone was the rooster crowing. I wanted to crawl under the carpet. I try to remember all this thing my grandma. Your kids don't do stuff like that. Yeah.
Somebody else need this? Yes, no?
Did
You
you all
have copies of this?
Mr. Hurd?
Yes.
All right, board, let's look at the first page, 110, the background. Take a moment to look over that. And I'll entertain any comments to the board. Background,
So I have some comments about our references.
oh, you mean the local data?
Yes,
Okay, can you wait till we get to that section?
well, that's under number one, but okay.
Oh, sorry, I'm sorry, you're right, go ahead.
I mean, if anybody's got a question about the first two paragraphs, that's fine.
Okay, and what is your comment about?
So I just want to point out that some of them are good references. The very first one, however, does talk about physical distancing plus face masks plus eye protection. So it's not a study just about face masks. The second study
I'm sorry.
talks about transmission of pre-symptomatic and asymptomatic individuals. I'm not sure what you guys are doing at Parkland, but I know where I work, we're not testing asymptomatic people, even if they've been exposed. And I think that that's the general recommendation. So the article does point out that they suspect transmission, but what we're doing right now isn't helping that because we're not testing asymptomatic people. The third one of Hansen, I think, is a really poor article because it is obviously very politically motivated in Forbes magazine. The next one, McIntyre, is again face masks and respirators, and somebody talked about those earlier. Respirators used by certain populations definitely more efficacious. So those are my comments.
Okay. The first one, and I don't know how to do that, Chu, Derek Chu, have you read that article? Because I have not.
Yes.
Okay. And you are not comfortable with it because it included more things than just face masks?
It's not an article just about face masks.
Okay, all right. Board members, any other comments about that section, first page? Continued on the top of the second?
We're kind of like including the physical, like the social distancing though. Like that's what we're trying to kind of promote too, I thought.
Well, yes, but this is
No,
about
the
face
two of them
masks.
go
This is
together.
about face masks.
Okay. All right. Did you note that? Dr. Denver had a concern? Okay. All right. 1.01, applicable. Provisions of the order of the Constitution authority of state statute, blah, blah, blah. Nothing in the ordinance to be construed to supersede rules or regulations of the Missouri Department of Health and Senior Services. Questions or comments? Okay. So we're saying we don't want to overstep. 1.02 definitions. And I don't know if there's any comments anybody wants to make, but I'll give you a minute to look through that. It's kind of long. These are pretty common, I believe, in ordinances and things. School board, you always do that.
So I do question when you're talking about face coverings and our definition. We have usually made with cloth, which covers the nose and mouth. Fleece is a cloth. Fleece has been shown to actually be worse than not wearing a mask.
And we're not debating whether it's effective. These are just definitions.
Well, then we may need to better define cloth mask.
Okay, well, would you
Because
suggest?
fleece is considered a cloth, right?
Say again?
Fleece is considered a cloth.
So do you feel better if we specify what type of cloth?
Well, I think that we maybe should exclude fleece for sure.
Okay.
I don't see the word fleece.
It's not, I'm
Oh,
saying,
you want it to be.
you're making the definition of a face covering usually made with cloth,
Okay.
but you can't just say cloth and not include fleece. So I think that we should exclude fleece because it's worse than not wearing a mask at all.
Time would be so no or objection? Okay. Board members, any other definitions that you maybe have a little confusion about or question?
Not a board member, but I do have a question about the definition of gatherings.
Couple of comments are older.
I'm sorry.
Okay,
Somebody else
well,
can-
okay, well,
maybe somebody else can bring it
I
up.
wanna be a good guy. Board, are we gonna allow comments?
I don't have a comment.
Oh,
Well, I guess it is a comment. I just think it ought to have
I'll
a number
recognize
assigned, I think it ought to have a number assigned to it. Is a gathering 2 people, or is it 10?
as a group, all right, now that's interesting. Would you know what that time is?
Yes.
Future reference? Please understand, I just don't wanna get bogged down with that.
I
But that was a good
understand.
comment, I think it's.
If nobody else is gonna pick it up, I'm just gonna
Well,
throw it
that's
out there.
fine. And again, we're not adopting anything tonight, we're just in discussion. I really thought somebody might have a question about public spaces. Okay, public transportation. Board, any suggestions, corrections, additions? All right, we'll go to purpose. How about provisions? 1, face coverings must be worn by, it says age 9, employees, ministers, president of business, or public entities. Smaller 2. Dr. Gamble? Mr. King? Any comments? Okay, what about the exemptions? Now, on the email, Facebook, we received comments. There were quite a few comments about people who had health issues, problems, and I'm assuming everybody read the email. Is there anything here that we have not covered, that the public asked about or commented about?
I would say based on the emails that we all received, that the exemptions here maybe go a little bit further than anything that has been mentioned in the emails.
A lot of people like commented on anxiety and it causing like more issues with that, and I can see people who have issues with trouble breathing are incapacitated,
You wanted,
otherwise unable to remove.
you wanted to add something?
No, I think C,
Where's that covered?
I think C covers
C?
everything
Trouble breathing, unconscious, unable to.
to some extent, yeah.
That's a good point, Tara. I don't know that, anxiety is actually covered there. There were comments in those emails about PTSD from, being, abused, especially children and women, and covering markings over their face caused significant anxiety, is something that needs to be added to that.
All right, why don't we, make a homework assignment that would think of something that would cover anxiety, and what was the other thing you suggested?
Well, and PTSD was mentioned in several of the emails.
Okay.
I did just read an article about the face shields, where like the face shields can protect more than, you know, if you aren't able to wear a mask, then maybe a face shield.
Do we have anything down about face shield? Mrs. Butler, are you suggesting we need something?
It could be something that we consider,
Okay.
if people aren't able to wear a mask.
Oh, okay. Any idea when you think that would be inserted?
I would think in the medical section.
Where?
In the medical section, and medical health conditions.
Yep.
Face shield. Okay. Donnie, are you getting these notes down?
Yes, I am. What
Something about anxiety and face shield?
Yeah, I've got that, I'm just, looking for what exact area you want to put the face shield part in.
Well, within the exemptions, I think. But that'll be a part of our homework assignment.
Okay.
Okay. Look at number 4. Businesses are authorized to deny entry, people who refuse to wear face masks. A business shall neither require the individual to provide medical documentation verifying a medical condition or disability, nor ask about the nature. I think that's very generous, personally. So in other words, if Bill Jones walks into a place and says, I have trouble breathing, I have asthma, the business would have to accept the word. Is that the way you interpret it?
Under the HIPAA regulations, they don't even have to say that. All they have to say is I have a medical exemption and they cannot be asked.
I think that sentence would ease the mind of a lot of the population. And if they, sorry to say that, if they choose to lie about it, that's their problem, not the businesses.
But I think that's the problem that we're having right now. Like, I had a 12-year-old in front of me the other day, said he had COPD. Like, maybe asthma, but, so,
You could have chronic bronchitis, which is COPD.
I think that's just where we would need to sit down and talk with our law enforcement agencies.
Say it again.
Where we would need to talk to our law enforcement, see where we stand, because with the stay-at-home order and stuff, we had issues, so.
Talk to you
Moving
further.
on.
How did you get that? On number 4? Okay. All right. On to number 5. Okay, here we go to application enforcement, 1.05. Board, any questions? Comments? Community. their job. Now, effective date, this sample, this draft says, full force effective on adoption, may be repealed, amended, rescinded at any time by the board. I really feel that if, next time we meet, that the board wants to proceed, we need to have an idea of when we would review. That it, you know, definite black and white date. Jason, what do you think about that?
I think obviously there are some concerns with the order as it's written right now, so, absolutely, there's some great ideas and some revisions that need to be made, consideration on things to include, and go from there. Obviously, it's not ready at this moment in time.
Any other comments, Dr. Damba, Mrs. Wadlow, Mrs. Bannister?
So, can I have a public comment?
Yeah.
So, under local data, I know they have mentioned like 7 studies. I just wanted to kind of point out, this is something that people in general don't know, but there's level of evidences, right? So you have level 1, 2, 3, 4, and 5. In general, opinions, you know, journalist comments, you know, public opinion, things like that, they're just considered level 5 evidence at best. The only thing inferior to that is animal studies, right? So in here, we have these specific articles, but really what we should do here to just put more credibility, I guess, is to just have the level 1 evidence, which is usually defined as evidence that is submitted to peer-reviewed journals, analyzed by a group of experts in those fields. For example, if I have a concrete problem in my house, I won't go to a chiropractor for that. You know what I mean? Like if I have a pulmonology issue. So I think simple thing to do, medicine is an evolving science. If I practice medicine today that is based on a guidance that changed 6 months ago, that is malpractice, right? That applies to us. You are required to follow the current evidence because the older evidence is outdated. And that means that as soon as the newer evidence is available, anything that you're quoting in the past is just not correct. So having said that, just peer-reviewed journals in general, these are just articles, scientific articles. You present these 7, I'll present 20 against the masks, and I'll present 40 for the masks. You know what I mean? And then we can all sit down and agonize about it, but I'm a statistician, I have a PhD in biomedical engineering, and I'm also a physician. And so I think here, instead of all of that, we could probably just have the national organizations and their comments. For example, what does American Lung Association say? What does American Medical Association say? What does American Hospital Association say?
Infectious disease.
Infectious disease. What does critical care say about it? And I'm sure if we select that, then it's hard to just go against these associations because they have experts who sat down, reviewed 50s and 70s of these studies for and against it, figured out which study had teeth to it and which one was absolutely worthless. Because if you present me with data, I can present it both ways. And I'm a statistician. I understand these studies. I've personally written 78 peer-reviewed articles. I have 4 current studies in progress right now in Parkland Health Center for the first time in Parkland. So my suggestion is instead of just putting individual studies, because then people, it just won't give you teeth. You know what I mean? Like people will come in and say, okay, this is not a randomized controlled trial, and this one is just, you know, it has like 45 patients, that means nothing to me. You know what I mean? Like, so instead of that.
How do you know that?
So just, and I don't mind. I think globally, healthcare physicians and experts in those fields, that's what they've done. This is not, we don't have to reinvent the wheel. We don't have to read articles. As a physician, I know that to stay up to date in medicine, there's actually an article on this. We have 17 medical articles that we have to read every day. Nobody reads that. And I read a lot. You know what I mean? If I'm lucky if I read 1 a day. So, at that point, the simple thing is to just actually listen to experts, you know, and just have those here instead of individual studies.
Okay. All right. Board members, any other comments? All right. I probably should have done this at the very beginning, and I will make an apology. You probably don't know who the board members are. So let's introduce yourself and tell where you work, and where you live.
My name is Tara Wadlow. My name is Tara Wadlow. I'm a nurse practitioner at Medical Arts Clinic in Farmington.
I'm Joan Bannister. I live in Deloge. I'm an RN, but I'm a retired RN, just as of May.
And retired school nurse. Okay, I'm Jack Poston. I retired after 31 years as an elementary teacher in the North San Francisco County School District. And I've been on the County Board of Health for 23 years. And you all didn't know that.
My name is Jason King. I'm superintendent of schools at Bismarck Norfolk School District.
I'm Vicki Gamba. I'm a family medicine trained physician, presently working for Mercy Health Systems at Urgent Care in Festus and Imperial. But I live in Farmington.
The board has traditionally tried to, when there's an opening, seek out people from different areas of the county. And I think we have that on the board. We've had that way for probably 23 years I've been on the board. So, all right, board, if there's no other questions, I will entertain a motion to adjourn.
Second?
Go ahead, motion.
Okay, I entertain a motion to adjourn. I cannot get
That's
this
okay.
right. I haven't been on here for very
Is
long.
there a second?
I'm good at second, but
Is there a second?
I second.
All right, roll call vote. Wadlow,
Yes.
Bamba,
Yes.
Bannister,
Yes.
King, and Poston. I'll vote yes. Thank you all very much. I apologize for the malfunction and the wait. You've been very courteous, and I might say the comments on Facebook have been very nice. None of them bad, they're very courteous, thank you, and I'm impressed with the population.
Thank you. Thank you very much.
We'll have to set up a special meeting.